Hi, my name is Dr. Neal Palejwala from Retinal Consultants of Arizona, and I'm one of the vitreoretinal surgeons here. I'd like to invite you for this session of questions from YouTube. Thank you guys so much for submitting your questions, and I wanted to go over some of the most recent questions that we've had asked on our YouTube channel. Our first patient asks, after a retinal tear or detachment surgery, can I work as usual using the computer? So that's a great question. After you've had a retinal detachment repair, oftentimes patients have some degree of discomfort for a few days. Sometimes they have to position their head in certain positions, such as laying on one side or the other side or looking down at the ground. If your computer work doesn't interfere with your head positioning restrictions that your doctor gives you, then it would be okay to use your vision. We don't tell patients not to use their eyes after they've had such surgery, and keeping your eyes open and using them more will sometimes help you learn to function better with your vision and kind of use both eyes together. So it is okay to use the computer as long as it doesn't interfere with the positioning restrictions that your physician has given you. Our second question is, can an infection cause flashes? I got my eyes tested after I got flashes, but my doctor said nothing was wrong. What else can cause flashes? And if the flashing goes away, is that good or bad? So that's another great question, because flashes are a common thing that we see in our practice, and I often see multiple patients a day who have flashes in their vision. So flashes can mean many different things. The most worrisome thing that we think of when we think of eye flashes is a retinal tear or detachment. What can happen in patients is, as they get older, the vitreous gel in the eye starts to separate from the retinal surface. And when it separates, it can pull on the retina, and that excites the retinal tissue and makes you perceive a flash of light. However, this is not the only thing that can cause a flash, and although it might be the most worrisome thing that can cause a flash and something that we want to rule out, sometimes people can get flashes of light for other reasons, such as an atypical migraine headache or an ocular migraine. Also, after having an eye trauma, sometimes that can induce flashes. Also, inflammation inside the eye or an atypical infection can sometimes also be perceived as flashes or reduced vision. So although it's not the only thing that can cause a flash, there are many different etiologies of flashes, but we want to make sure that when you come in to see us that you don't have an acute problem that needs urgent attention. Our next question is, I had a retinal tear lasered 5 days ago, but I'm still having flashes. How long does it take to recover? So after a retinal tear procedure, it's common that patients still have persistent floaters or flashes. The laser procedure for the tear doesn't actually make the floaters or flashes go away. That can take time to improve. The purpose of the laser is strictly to seal off the retina around the tear so that the tear doesn't propagate or fluid doesn't accumulate underneath the retina, causing a retinal detachment. It can take several weeks for the floaters to improve, and sometimes patients have persistent floaters, but luckily in most people their brain learns to turn that floater off. The flashes can also persist for several weeks, but they should be getting slowly better over time. If you notice an increase in floaters, like a shower of new floaters, or new flashes or more persistent flashes after you've had a procedure and it's getting worse, then we definitely want to see you sooner. But having persistent floaters or flashes that are improving are a normal part of recovery. Our next question is from a patient who has type 2 diabetes since 1998. They've been doing very well with their diet control and their blood sugar and weight and exercise and all the things that their doctors have suggested to them. However, he was recently diagnosed with diabetic retinopathy, and he wants to know, what is the best way to prevent this from progressing so that he doesn't need laser treatment or injections in the future? And this is a very important question, and I would strongly emphasize this to patients who have diabetes, because diabetic retinopathy is one of the leading causes of vision loss in our community, and it's one that doesn't need to be that way if it's identified early. So patients with early diabetic retinopathy where they still have good vision, we want you to strictly watch your blood sugars and blood pressure, because we know that by strict diet control and taking your medicines regularly, this can reduce your risk of progressing by over 75%. Patients, sometimes even though we've been very good with our sugar, sometimes the years of having high sugars or diabetes can catch up to us, and so sometimes patients can have some degree of damage. Following up with your ophthalmologist on a routine basis is very important, because if they see early signs of bleeding in the retina or swelling of the center retina, they can intervene and prevent progression. And that's really important, because oftentimes when patients present with vision loss, we're already a little bit behind the 8 ball and we're having to play catch up, and sometimes vision lost is vision lost, and so we need to really treat patients early and aggressively to maintain long-term vision. Our last question comes from a patient who has peripheral retinal lattice degeneration, and they have small holes in their retina, and they've been followed carefully by their doctor, but no treatment has been needed for now. And so they are wondering what they should do in follow-up, and is there anything preventative they can do? Well, I think you're doing the exact right thing. Having close follow-up with your retinal specialist is very important. Patients who are nearsighted, meaning they have myopia, they often have thin retinas and can develop a condition called lattice degeneration. It's a very common condition present in about 7% of the population. And oftentimes the retina can be so thin that there are small little holes. We call those atrophic retinal holes. Now, when patients hear about holes in the retina, they think about retinal tears, retinal detachment, and those are, worrisome, urgent things. However, patients with small holes within lattice degeneration are often watched without any specific treatment, because they usually do not progress to things like retinal detachments. However, when you do have nearsightedness or lattice degeneration, you are at a slightly higher risk than the average person for developing a retinal detachment, and so you have to be very cognizant of your symptoms. So if you see a shower of new floaters, new flashes of light in your vision, or a loss of vision, then you definitely want to present to your eye doctor as soon as you can, so that they can identify if there is a new retina problem going on. But otherwise, getting follow-up routinely on a 6-month to a year basis, if everything is stable, is definitely indicated. And the second part of this question is, does sitting in a car or working as a driver increase the risk of retinal detachment, or is there an increased risk when you have sudden braking in your car? And this is a very great question, because sometimes trauma or whiplash injuries can cause problems in the retina if they are severe enough. However, driving or using your eyes or normal movements do not increase your risk of developing a retinal tear or detachment. So I wouldn't worry too much, but if you do get in a car accident or something with a lot of trauma, then I would get checked out, because you are at a slightly higher risk by having the trauma. Well, that concludes our session today. Thank you so much for your questions, and we really do encourage you guys ask us as many questions as you can, because we really want to make sure we educate the community in what's going on in the world of retina. Thank you very much.